It has withstood dozens of challenges in Congress. It's withstood the scrutiny of the Supreme Court, and it is currently the law of the land. Is this a settled issue, or in your opinion, where should we go from here? Mr. McFadden, let's start with you.
Roger, thanks for the question. We have a healthcare issue in this country. I know that as a businessman. But I guarantee you that Obamacare is the wrong answer. It is a train wreck. And that's quoting a Democrat, Senator Max Baucus. And this train continues to wreck. And Al Franken was the 60th vote for Obamacare. We wouldn't have this disaster but for Al Franken. And what frustrates me to no end is that this policy was implemented based on lies. It's the largest domestic policy initiative in a generation. And it was signed and nobody read it. And then it was based on mistruths. The first one being that you could keep your insurance policy. Well, 140,000 Minnesotans found out that that wasn't true. The second being that you could keep your doctor. Well, we know that's not true. But the biggest lie of all is that it will cost less. President Obama, who Senator Franken has voted with 97% of the time, has said repeatedly that it will lower the average cost of insurance for a family by $2,500. I'm going to tell you the truth. That is a lie. That will not happen. Period. I've come forth with my own plan. I look at costs, I look at accessibility, and I look at quality. And my plan will lower costs, increase accessibility, and maintain quality. And Al Franken will say, I don't have a plan. No, I have a plan. I put a proposal forward. Obamacare is a disaster. It's not working. It's too expensive. We can't afford it. And I will tell you the truth. And I will roll up my sleeves and I will go to Washington to get this fixed. And I'll make sure that people with pre-existing conditions can get insurance at a reasonable rate. That's a promise.
Senator Franken?
Well, look, there have been obviously problems with the rollout in ACA. And my job is to make the Affordable Care Act work as well as it can for every Minnesotan. But let's look at what's happened. We have reduced the number of uninsured in Minnesota by over 40%. Minnesota now has 95% of its people with health insurance, second in the country. People with pre-existing conditions can no longer be turned down because they have a pre-existing condition. If you hit what used to be have lifetime limits, if you hit your lifetime limits, you were thrown out. I talked to a mom whose daughter has cystic fibrosis, who had hit her lifetime limit. Her child was alive today because of the Affordable Care Act. Kids now can stay on their parents' policy till they're 26. Seniors get free preventive care, and they've seen the pharmaceuticals that they buy under Medicare Part D. They've seen that donut hole closing, and it will close completely. Medicare's solvency has been extended by 11 years. Do you want to take that away? Part of the reason for that is it now costs $1,000 less per Medicare beneficiary than was projected in 2009 that it would cost now. And that's because of the reforms that were made. And that's because of the unbelievable work in delivery reform, healthcare delivery reform, that we do better than anybody in the world, or at least in this country, in Minnesota. We lead in that. And we need to continue to incentivize health care and not sick care, which is what we used to do when you do pay per service. We have a number of, so many accountable care organizations in Minnesota that are doing unbelievably delivery reform. Understand this, if he repeals this, if they repeal this, it goes back to square one. It goes back to square one. And it goes back to a divided Congress, and all of this goes away.
Mr. McFadden?
Al, let's be absolutely clear. Obamacare is a train wreck, and it continues to wreck, and I will fix it. We have a healthcare issue in this country. I've traveled around our great state. I've been to all 87 counties, in the last 6 months. And I have story after story from people where this system is not working. The 29-year-old man who has type 2 diabetes, who lost his insurance, despite the president's promise. He has to go on the exchange. It costs 2 times more. God bless him. I hope he didn't have preferred one, because now he's got to go find a new policy at a more expensive rate. I was in Rochester last week. A woman came up to me with a look in her eyes between fear and anger. She works at the Mayo Clinic, which is the largest private employer in the state. She just received her premiums in the mail. And you know what it's going to cost her next year? 50% increase. 220% increase in the deductible. That's not fair. We do have the best health care in Minnesota. That's the difference between Al Franken and I. I want to solve it on a state level. I believe Minnesota has the best healthcare minds in the world. I believe the states are laboratories for experiment. If we allow the federal government to do it, our healthcare system will look like the VA. And I'm not going to allow that to happen. I'm going to fight for you.
Senator?
Well, of course, MNsure is a state system. And understand this, and we're really at a turning point here. We can do one of two things. We can repeal the Affordable Care Act and go back to square one. No guarantees that you get health care for pre-existing, if you have pre-existing condition. No guarantees that you won't pay more if you're a woman, just because you're a woman. No guarantees that once you've gone through your lifetime limit, you're just thrown off. 50% of all bankruptcies in this country have been caused by healthcare crises. We have a choice here. That's the difference between Mr. McFadden and me. Make no mistake about it. You repeal this, it goes back, and there will be 538 different health plans. And do you think that this Congress now, as gridlocked as it is actually going to come up with a healthcare plan that gives people guarantees that they have pre-existing conditions and all the other stuff that we've seen?